Okay, we have another question, and I believe this is from Scotland, right? Okay, from Scotland. Go right ahead.
Do doctors ever consider medication for oppositional defiant disorder? And if so, when?
Do doctors ever consider medication for oppositional defiant disorder? Yes, they do. There would be 3 reasons to consider this. 1, if medically treated comorbid conditions were present, for example, ADHD or depression. 2, if non-medical interventions are not successful. And 3, when the symptoms are very severe. So those would be the 3 cases that a psychiatrist may consider medication, although pharmacotherapy is not the first line of defense with ODD or CD. Parent education training would be the first line of defense with these 2 disorders. What drugs would a psychiatrist use in the event that he decided to go with that kind of therapy? Well, he would use a drug that's proven safe in children, that has no long-term side effects, and that's been found in research studies to be effective in extremely aggressive children and adolescents, or in comorbid conditions which children with conduct disorder often have. Now, each drug has certain problems that need to be watched for. The current medical literature suggests 3 basic principles when using psychiatric drugs in children. 1, start slow. 2, go slow. And 3, monitor carefully. Now, what I mean by start slow is you don't want to start any of these drugs at the usual dose or the maximum dose. If you had pneumonia, it could be a real emergency, and you would want to give people plenty of medicine right away if they had pneumonia. And if there are any problems with the dosage, then you would reduce it. But unfortunately, many people use this same strategy in the medical treatment of ODD. The problem is that big doses can cause big problems, and when the problems affect your mind and personality, this usually means trouble for the person taking the medicines. So the psychiatrist will usually start with the lowest dose possible. Now, the drawback there is you may not see the results that you want to see, at least initially. And what I mean by go slow is oppositional defiant disorder is not an acute illness. Less than 10% of people that I see with this need to be treated very quickly. Okay, let me repeat that. Less than 10% of the ODD clients that I see need to be treated quickly. Most people who I see with this problem have had it for years, and as a result, there's no need to increase the dose quickly. By going slowly, it's a lot easier to manage any side effects because things don't happen suddenly. Also, it's easier to find the lowest effective dose. And lastly, what I mean by monitor is for each of the medical treatments for ADHD, for example, there are specific side effects which need to be checked regularly. Some common ones are monitoring weight so that people are gaining weight, watch for tics, watch for depression, checking blood pressure and pulse, checking blood tests and EKGs, and making sure parents know what the side effects are of the different medications. So in this way, if there is a problem, we can pick it up early and avoid the horror stories, some of which are true, about medical treatment of ODD and CD. Thank you for your question.